we are starting with slide number 34 in the Chapter 1, Part A slides. And we are on section 1.4, homeostasis. Homeostasis is basically the theme of this entire course. It's defined as the maintenance of relatively stable internal conditions despite continuous changes in the environment. There we go. Okay. So factors that can change that have to be regulated by this process called homeostasis are blood sugar, which is really, the sugar is glucose, so blood glucose levels, body temperature, blood volume, blood pressure, heart rate, levels of any chemical in the blood like sodium and potassium and calcium. So there are three components involved in regulating these variables by homeostasis, and they would be the receptor, the control center, and the effector. The receptor is the sensor. The control center receives the input from the receptor and determines the response, and the effector receives the output from the control center and provides the response. So in negative feedback, which is the most common, most used feedback mechanism in the body, the response of the body reduces or shuts off the original stimulus. It's opposite or negative. It negates the original stimulus. In other words, the variable changes in the opposite direction of the initial change. If your temperature goes up, then negative feedback causes it to drop. If your temperature drops too low, negative feedback causes it to rise. So examples are regulation of body temperature, which is controlled by the nervous system. Another example is the regulation of blood glucose, which is controlled by the endocrine system. In the case of blood glucose, first of all, hold on. Oh, here we go. Okay, so in the case of blood glucose, there are receptors that sense increased blood glucose or blood sugar. These are chemical receptors. And then the pancreas is the actual control center in this process. The pancreas will secrete insulin into the blood, and then the insulin causes your body cells, such as the cells of your liver or the cells of your muscles. These are the effectors. It causes these body cells to absorb more glucose, and that lowers the glucose levels in your blood. There is a good animation on negative feedback in slide number 40 that you can go to the slides and look at. This is the feedback for body temperature if body temperature rises too high or if it drops too low. So if the body temperature rises, the receptors are found within the skin and the brain. The thermoregulatory center in the brain is the control center, and it's found in the hypothalamus. And it will send messages to the effectors, such as your sweat glands, and cause you to sweat more. And then the evaporation of the sweat helps cause your body temperature to fall back to its normal 98.6 or close to it. Now, if the body temperature does drop too low, you get too cold, you still have temperature receptors in your skin and in your brain that send signals to the hypothalamus. That's your control center. And the hypothalamus sends signals to your skeletal muscles, and you start shivering, and that causes your body temperature to rise. So that's an example of negative feedback. You've had two examples of negative feedback, and that is temperature and blood glucose levels. Now, positive feedback is when the response enhances or exaggerates the original stimulus. there's not a lot of examples of positive feedback, but labor, when a female goes into labor and begins having contractions, it is a positive feedback mechanism because the contractions trigger the release of oxytocin from the pituitary gland. And the oxytocin increases the contractions, and those contractions increase the release of oxytocin. And it is a cycle that continues until the baby is born. So positive feedback increases the stimulus until the process is over. And then blood clotting is another thing where the blood begins to clot and releases chemicals that increase the clotting. And then it clots more chemicals are released. And this happens until the blood actually seals off the area of bleeding. Here you can see it in more detail. There's a break or a tear in a blood vessel wall leading to bleeding. And then platelets adhere to the area of damage, and they begin to release chemicals. And then those chemicals draw more platelets to the area, and more platelets come in, more chemicals are released, more platelets come in, more chemicals are released, and this happens until the plug actually seals the wound and a clot is formed. Now, when homeostasis is out of balance, you have a higher risk of disease, and it can also lead to death. It can lead to heart failure and other organ failure. Now, what we're going to do, since it's only about 7 minutes, is I am going to go to section B, chapter 1, section B, and just start on that one. Here we go. All right. So now we're going to talk about anatomical terms. This is the chapter that it's really, really, really important that you learn these anatomical terms because they will help you in learning your bones and your muscles and other structures. Now, you do need to know that when a body is in standard anatomical position, when a person is in the standard anatomical position, they're standing up, for one thing, their body is erect. Their feet are slightly apart, maybe shoulder width apart. Their palms of their hands are facing forward with the thumbs pointing away from the body. And then we have directional terms. The word for up, which typically means toward the head, is superior, and you can also use cranial. The word for down, which means toward the lower part of the body or below, is inferior or caudal. Toward the front is anterior or ventral, and toward the back is posterior or dorsal. Toward the midline of the body is medial. Toward the sides is lateral. And between a medial and a lateral structure, we use the term intermediate. Proximal and distal can be kind of hard to learn. because we're always referring to the shoulder joint or the hip joint. So if I say that something is proximal in reference to the shoulder joint, it's closer to the shoulder joint. If it's distal, it's further away. So, for example, the elbow is proximal to the wrist. That means the elbow is closer to the shoulder or to the attachment to the trunk of the body than the wrist is. Now, we can turn this around and say the wrist is distal to the elbow. And then in the same way, we can say the knee is distal to the thigh, because the knee is further away from the hip than the thigh is. Or we could say the thigh is proximal to the knee. Okay? Then we have superficial, which is close to the body's surface, and deep, which is away from the body's surface. So you need to know these directional terms and how to use them. There are some examples in your assignments, in your mastering assignments. Okay, so regional terms. There are two major divisions of the body. There's the axial and the appendicular. So the axial portion of the body includes the head, the neck, and the trunk. The appendicular includes the legs and the arms. Now, you definitely need to know these terms, and I'm going to blow this up as big as I can so you can see them all at one time. This is an anterior view. And these are the body regions. So the cephalic is the head region, frontal is the forehead, orbital is the eye socket, nasal is the nose, the cheek is buccal, the mouth is oral, and the chin is mental. The neck is cervical. The chest is thoracic, where the breastbone is the sternal region. The underarm or armpit is axillary, and the breast is mammary. The abdominal region is purple, and the umbilical region is near the navel, or it's at the navel. The pelvic is the hip region. The inguinal is the groin. The hip itself is called the coxal region. And then right in between where the legs meet is the pubic or genital region. And if we start over here with the upper limb, the top part of the shoulder is the acromial region, where there's like a bone that sticks up, acromial region. The arm, in anatomy, the arm is the upper arm, and that's the brachial region. Then we have the bend in the elbow, which is the antecubital region. The elbow itself, on the posterior side, is the olecranal region. The forearm is antebrachial, and the wrist is carpal. The hand is manus. The big part of the hand is the metacarpal. The hand bones are the metacarpal bones. And the palmar surface is called palmar. The thumb is the pollex. And then the fingers are digital. We already said coxal is hip. The thigh is femoral. The kneecap is patellar, and the back of the knee is popliteal. The leg in anatomy is the lower leg. The upper leg is called the thigh. So the leg is crural, and then the back of the leg, the posterior side, is sural. So the leg is crural. That would be what I would refer to as the shin, and then the calf is sural. And then fibular is the outside of the leg, the lateral side of the leg, fibular or perineal. The foot is pedal, the ankle is tarsal, the heel is calcaneal, the top of the foot is metatarsal, the toes are digital, the bottom of the foot is plantar, and the big toe is the hallux. And the posterior view will do the same thing. The acromial is the point of the shoulder. Brachial is the arm. Antecubital is the bend in the elbow. Olecranal is the elbow itself. Antebrachial is the forearm. Carpal is the wrist. The hand is metacarpal. The front side of the hand is the palmar. And then the thumb is pollex, and the fingers are digital. The hip is this region here. The thigh is femoral. The kneecap is patellar. The back of the knee is popliteal. The front of the leg, anterior portion of the leg is crural. The shin region is crural, and the calf is sural. The lateral side of the leg is fibular or perineal. The foot is pedal. Ankle is tarsal. Calcaneal is the heel. Plantar is the bottom of the foot. Metatarsal are the foot bones. Digital are the toe bones. And the hallux is the big toe. And then we also have perineal. Peroneal is for fibular. Perineal is the area between the anus and the external genitalia. Then we have gluteal for the buttocks, sacral, which is where the sacrum is in your vertebrae, but it's up here sort of at the superior region of the butt cheeks. Then we have the lower back, lumbar. The spine is vertebral. The shoulder blade is scapular. The back itself is dorsal. Neck is cervical. Back of the head is occipital. The ears are otic. And those are your body regional terms.